Anterior cruciate ligament (ACL) injury is a common knee injury that can occur in athletes or anyone who engages in activities that require sudden stops, changes in direction or pivoting. The ACL is one of the four main ligaments that help stabilize the knee joint, and when it is injured, it can cause significant pain and limit mobility. In this video, we will explore the causes, symptoms, diagnosis, treatment, and prevention of ACL injuries. Causes. The ACL can be injured in many ways, but the most common cause is a sudden twisting or pivoting motion of the knee joint. This can happen when an athlete lands from a jump or when they change direction quickly while running. Another common cause of ACL injury is a direct blow to the knee, such as a collision during a sports game or a fall. Symptoms. The symptoms of an ACL injury can vary depending on the severity of the injury. In mild cases, the patient may only experience slight discomfort or pain in the knee. However, in more severe cases, the patient may experience a popping or snapping sensation in the knee, severe pain, swelling, and limited mobility. The knee may also feel unstable or like it will give way, and the patient may have difficulty bearing weight on the affected leg. Diagnosis. Patients who suspect an ACL injury should see a doctor immediately. The specialist will physically examine the knee to check for pain, swelling, and instability. The doctor may also order imaging tests, such as an MRI or X-ray, to confirm the diagnosis and determine the severity of the injury. Treatment. The treatment for an ACL injury depends on the severity of the injury and the patient's overall health. In some cases, conservative treatments, such as rest, ice, compression, and elevation, may be sufficient to manage the symptoms of the injury. However, surgery may be necessary to repair or replace the torn ACL in more severe cases. Rehabilitation is also an essential component of treatment for an ACL injury. After surgery or conservative treatment, patients will need to participate in physical therapy to help them regain strength, flexibility, and mobility in the knee. The rehabilitation process can take several months, and patients must follow a strict exercise regimen to achieve optimal results. Prevention. While ACL injuries can be challenging to prevent entirely, there are some steps that athletes and anyone who engages in physical activity can take to reduce their risk of injury. Maintaining good physical conditioning, including strength and flexibility training, is one of the most important things. Using proper techniques and equipment, such as knee braces or wearing appropriate footwear, is also crucial. In conclusion, an ACL injury is a common knee injury that can cause significant pain and limit mobility. While it can be challenging to prevent entirely, there are steps that patients can take to reduce their risk of injury, such as maintaining good physical conditioning and using proper techniques and equipment. If a patient suspects that they have an ACL injury, they should see a local specialist or one at the DKC as soon as possible to receive an accurate diagnosis and appropriate treatment.